Here with Dr. Mark Glasgold, plastic surgeon. And Mark, can you just introduce yourself?
So I'm a facial plastic surgeon. My medical practice is exclusively aging face surgery. So I do facelifts, eyes, it's all elective cosmetic surgery. And almost every patient who comes in wants to know, what can I do so that I can heal better, so that I can recover quicker, so that my scars heal better. And that's almost always the first question that they ask.
Now, Mark, you and I have known each other for 20 years, as of July. And you followed my work right from the beginning when I got back from the United Kingdom with my degree in herbal medicine. Now, you've been very supportive of my work for your patients. So what kind of patients have you recommended to me? What stands out to you when you're recommending me to somebody?
Well, let's take a step back, okay? So medicine, as we know it, focuses on disease states. And I'm not really dealing with diseased patients. I'm dealing with well patients who want to do better.
Correct.
And what I found very interesting about the way you were approaching things is you were focused on wellness, on how do I maximize someone's wellness. Even more so, you can treat disease, but that was what appealed to me because I'm dealing with essentially well patients. So when I'm thinking about who is an appropriate referral for you, really the number one thing are patients who I think are going to follow through, because everyone sort of wants to know what I can do to heal better, to get through this better, but when it comes down to actually following through and doing the things, if they're not going to be compliant and they're not going to put the effort in, it doesn't really seem worth you putting the effort in for them.
Very true, because the consistency and compliance are essential to this working. Herbs are the same thing as what's in our foods. It's very nutritionally based, but there are compounds that you can't possibly consume in your foods. And it takes time to build it in the system. So it always made me feel affirmed in my clinical background and the clinical value of this work that you have embraced it and provide that kind of endorsement for this kind of complementary work. So thank you for that.
You're welcome. And I think the patients who have embraced it have been glad they've embraced it and have seen the benefits of it. So there are two kinds of patients who I refer to you. People who are healthy and people who really aren't healthy that really need a prep for surgery, and they're two very different kind of people to me. So I have patients who have been preparing for surgery in their whole life, in the sense that they watch what they eat, they're on anti-inflammatory diets, they're at a good body weight, they're exercising, and when those patients are looking to sort of get that edge, those are ideal patients for both of us because they're motivated and you have a lot to work with.
Yes. They make my work easier, much easier, because you don't have to make adjustments in their foods to the same degree as somebody who needs a little bit more support. Can you talk about the people that might not be on their game with their diet and their habits, but those sorts of people?
So one of the things I was going to ask you is, what do you focus on the healthy patients? What's your focus in terms of how you're preparing them for surgery?
Well, similar to people that need more support, you're still focusing on the integrity of the connective tissue under the skin. You're still looking to improve the vascular integrity, the small vessels, the capillaries, the arterial integrity, but also the venous return. So you're looking for the ability to return the waste products back into the system through the lymphatics.
And that'll help reduce the swelling after surgery.
Works with the swelling, but it can also minimize the bruising, because if you can prevent excessive bleeding. You can limit the amount of bruising that trails through the tissues.
Yeah, vascular integrity is very important to me when I'm operating. So patients who have very robust vasculature, blood vessels, it's easier for me technically to control their bleeding because their blood vessels aren't just falling apart as I'm operating. Say I operate on a smoker, their blood vessels just fall apart while I'm operating. Whereas if I have someone who has very strong vessels, I can cauterize each one and really reduce the amount of bruising they're going to have. So it makes a huge difference for me. So with a healthy patient, how far in advance of surgery do you think it's good for them to start to really see the benefits of what they're doing?
Well, you talked about the first group of patients, the ones who are on their game.
We're talking about the healthy patients.
The healthy patients. I would say between 2 to 3 weeks in advance of surgery is the minimal. The longer you prepare in advance, obviously we can identify some of the subtle aspects, perhaps chronic allergies, things that might compromise the fluid drainage into the lymphatics of the head and neck. So obviously a month in advance is ideal, but we can support those healthy patients within 2 to 3 weeks prior.
And you'll carry them through the postoperative period.
Correct, yeah. As you know, we end up filling at least 2 weeks afterwards. I like to touch base at that 2-week point, and if there's any residual swelling or bruising, we maybe need another week. In certain individuals.
And I always like to say to patients that we can get you functioning in under 2 weeks for most people, except for some of the more traumatic procedures which are tough, but for most people we can. And your sort of target of about 2 weeks afterwards really is very consistent with what we're shooting for with the patients.
That's really nice to hear that we find that synergy of recovery time. Now, over time, I've noticed a significant reduction of difficulties after surgeries for recovery. I've noticed many patients having very, very minimal bruising, very minimal swelling. Does that have anything to do with the procedures that you're doing now, the equipment that you use, the techniques you use?
No, what you've noticed is you're seeing less people who are getting fat transfers. So because patients are so oriented towards fillers these days, and many patients are coming in sort of fully volumized, we're not doing fat transfers. And fat transfers have the longest recovery, the most bruising, the most swelling, the most distortion. Something like a facelift, where as the surgery is going, I can technically control the bleeding. So if I have someone who's in really good shape, I can really control the bleeding, and so you can really control the postoperative course much better.
That is wonderful to hear. So we shift from the healthy patients to the people that are coming to you.
Right. So there's quite a few patients who have not taken care of themselves. Sort of on the worst end of the spectrum are patients who smoke, and I do operate on smokers. I've operated on smokers for a long time, and their tissue integrity is just not the same. You really understand someone's health when you go in and you look at their tissues. And smoking is not good. People who are overweight, that's also problematic. You are what you eat. You're only as healthy as the food that you're putting into yourself and the poisons you're putting into yourself. And so these are people who really can benefit because they're somewhat compromised in their healing abilities. They're not going to heal their incisions as well. They're going to have a little bit of breakdown at their incisions. We can get them through it. We can get them good results, but it's not as easy. Sometimes I have to be a little more conservative in the surgery because I'm afraid of their tissues being able to take the stress. So those are people who and they also tend to be harder to get referred to you because they tend to be less compliant. But when you get them, what do you feel that you need someone like that for? How far in advance do you feel that you need someone like that?
I think that type of patient requires a much longer fuse, a longer preparation phase, because the depletion of nutrients is one thing, but as you mentioned, the connective tissue, building connective tissue, requires hormonal input, and you really can't just go after symptoms and cause and effect type of support. You really need to go into other aspects of their health history and their health picture. Now, sometimes I've seen patients who may hide medications that they may take because they're afraid. They hide from their doctors because they're afraid that they won't be able to get the procedures that they would like to get. And on occasion, I've seen some protracted healing that we have to keep after the fact, because these medications can deplete the body of certain nutrients, but it's not just the nutrition, it's the hormonal management. And so that often takes 3 to 4 months in advance to see that play out.
Yeah, there's been a real, I think, tragedy with mainstream medicine not supporting hormone replacement therapy in women, and we're just starting to see a greater embracing of it. But there's no question that women who have not had hormone support, one, they have trouble losing weight. They don't have the energy. Their skin doesn't look as good. I won't operate on somebody who has low thyroid, hypothyroid. You have to replace their thyroid. But even the estrogen and the progesterone makes such a difference. And when you're operating on healthy tissue, it's great. When you're operating on inflamed, unsupported tissue, it's dramatic, the difference in wellness in people.
And this takes cycles. We often say in my work is that whatever you're experiencing today, if your imbalance begins today, you look back 3 to 4 monthly cycles to see what was going on that perpetuated the imbalance. So when you're dealing with a perimenopausal woman, or even men go through hormonal changes as the years roll past 40 and 50, we are looking at a deeper view. But it doesn't mean we haven't gotten results. If they're just looking for bruising and swelling, we have seen results, but it's just a better result. It's a more refined result when we begin sooner before the procedure.
I think it goes to the patient's motivation, right? Those patients who have not taken care of themselves, but when they're having surgery, have that moment which is like, this is serious. I need to really put everything I have into this. I'm spending a lot of money. This is a one-time deal. Mm-hmm. This is my face. I have to live with it. They're sometimes more ready to make a larger investment of their time and effort to prepare for that. So one of the things that you said, I think, is also interesting, because I have a lot of patients who are scared of hormone replacement, and so it's nice to know that they can get some hormone support from natural remedies and don't have to go on to synthetic hormones that sometimes they're hearing bad things about from their doctors.
Right. And I'm not coming in saying that this is the be-all, end-all, because there are some people who are on medications that we can't discontinue, and we need to be able to work with it and support what that purpose of medication is. So it's not that you can't begin this type of work if you're already on a medication. And in some cases, like you said, we can't not support the hormones, but we do have natural alternatives that have seen a great amount of success with these.
I think you're a fabulous resource. I think you provide an opportunity. I do wish more patients would take advantage of it, but again, it's a commitment. It's not it's like anything. But it's a short-term commitment. It's like having surgery. Patients are like, "What do I have to do when I'm recovering?" I'm like, "You don't have to do anything. I did all the work. You know, you just laid there. I did the work, and now you're going to recover. You're fine." If you really wanted to do something, you should have spent a month or so, you know, preparing your body for the surgery, and that would have carried you through. And you know, it's just wonderful to have a resource that those patients who are interested want to take advantage of. You know, hopefully, as the word gets out, more people will take advantage of it.
I appreciate that. It doesn't mean to say that if somebody didn't realize that this was an option, sometimes it's overwhelming. Just the decision to come and see you and have surgery, they may not think to ask you until after the fact or very close to the procedure. We see that in any doctor's appointment. People get nervous. There's a lot of thoughts going through their mind. Like you said, you're dealing with their face. It's a sensitive, topic.
Usually by the time we've gotten through a consult, they've absorbed more information than they could possibly absorb. And so to start going down this path is often, it's just, they're not hearing what's being said. So it's important for there to be a way for them to get this information when they go home, and patients do it. They go home after a consult, they start doing a lot of research, get on the internet, and often if they discover it on their own, they're more motivated to follow through with it. So, you know, that's why this is important.
It is, and at least people know that, let's say they didn't think to ask, they didn't do their research, but they're left with some residual yellowing or swelling. We do see very successful results within a week or two to finish out that healing course of time. So it's an option. And I truly appreciate your coming together with me to share that with other people. It's one thing for me to say I receive referrals from surgeons who are internationally known. It's quite another thing to be able to sit down with you and share this with people today. So I thank you.
You're very welcome. You're very welcome.